lacrimal duct right here and into the nasal cavity. Now, that's why a person's nose starts to run when they're crying a lot, because that's where the nasolacrimal duct obstruction is the topic, and this is sometimes also referred to as dacrostenosis. And I think the best way to talk about this is to draw a diagram and then label all the different parts and then explain what each of these parts are doing and then take it from there. So just drawing basically all the players involved here, and then I'll explain what each of these do. And then I'll be able to explain everything. So here we go. Well, as you can probably figure out, this is of course the eye, and then right above the eye you have this, which is the lacrimal gland. And the lacrimal gland is responsible for producing tears. And then the tears flow in, I'll use a different color, orange let's say. They flow in this direction, of course. The tears go to the surface of the eye, and then eventually they go into these little canals, and appropriately they're known as lacrimal canals. There's two of them, one here and one there. And then the tears then flow down through this area, and this top area is known as the lacrimal sac. And finally we get to this part, which is known as the nasolacrimal duct. Now, this topic is of course the obstruction of this, either a obstruction or a stenosis. And what that does is it prevents the proper drainage of the tears into this area. Now, what is this area? This area is the nasal cavity. So when everything's working properly, the tears drain into the nasal cavity. If this is blocked or stenotic for whatever reason, then the tears cannot drain into the nasal cavity. So I wanted to talk about this so that you understand. So the lacrimal glands produce tears. The tears then go from the eye's surface to the lacrimal sac, then to the nasolacrimal duct right here, and into the nasal cavity. Now, that's why a person's nose starts to run when they're crying a lot, because that's where the tears are going. So that is basically the anatomy involved. Now, it can be congenital, meaning the child is born with it because of some inadequate development of the nasolacrimal duct, or it can be acquired later on in life. And there's many causes of it later on in life. Some of them are inflammatory disorders such as sarcoidosis, Wegener's, granulomatosis. So if a person does have nasolacrimal duct obstruction, how will they present? Well, most commonly the clinical vignettes involve an infant, and most commonly you'll see that in a licensing exam. You'll have a baby that's tearing a lot, crusting of the eyes. Sometimes there's also some purulent discharge from the eyes. And this can also lead to cases of conjunctivitis. And that's really the presenting complaints that the parent will have. A diagnosis is usually just a history and really just a clinical evaluation with a physical exam. And if it is suspected that is nasolacrimal duct obstruction, fortunately the treatment is very straightforward. You just instruct the parent to do a simple massage of the nasolacrimal duct area. And The good news is that 90% of cases will resolve just by doing that. Now, if it's usually an adult that has this, and that's not that simple to treat, then they can surgically create a passageway to help drain those tears. And so you create a surgically created passage from the lacrimal sac to the nasal cavity. But that's very rarely done, but I just wanted to mention it. But majority of the cases, this will do the trick. Just a simple massage of that area will help move those tears through the stenotic area of the nasolacrimal duct into the nasal cavity. So let's take a look at a couple vignettes. 8-week-old infant is brought to have excessive tearing of the left eye on his well child with a visit. During the exam, he's found to have overflow of tears into the lower eyelid and cheek, and frequent appearance of mucoid material that the mother continuously cleans away with wet gauze. The infant was born at home to a 28-year-old gravid 2-para-1 healthy mother. There were no complications during the bathtub birth. Mother denied any recent vaginal infections or discharge before delivery. The child is otherwise growing and developing well and feeding on breast milk. What is the next best step? Well, this is just a very basic case of nasolacrimal duct obstruction. And conservative management, of course, is the next step. And let's see which one. Right here, the massage. D. It's pretty much all you need to do to treat this. And finally, 3-month-old boy is brought to the clinic by his mother because ever since the child was born, he has had constant tearing from both his eyes. She tells you that when the baby wakes up in the morning, there is a small amount of watery discharge at the medial corner of his eyelids, and that she must wipe the child's eyes multiple times throughout the day. Child is developing normal, is reaching his normal milestones. Physical exam, the baby is able to fix and follow you with either eye. Extraocular movements are full. Pupils are round and reactive. There's no relative afferent pupillary defect. Conjunctiva sclera cornea normal. There's a bit of dry crust on the medial side of the left lower lid. The most appropriate next step in management is just another clinical vignette describing the exact same thing. All you need to do is tell the mother or the father to just do a massage of that nasolacrimal duct area. And that would be choice C. Right there.
Víš, podle čeho se pozná dobrá angličtina? Já jsem si celý život myslel, že je to podle toho, kolik slovíček znáš, jak
Lacrimal apparatus. Introduction. The structures concerned with the secretion and drainage of lacrimal tear fluid together form the lacrimal apparatus. The lacrimal apparatus consists of the following structures: lacrimal gland, ducts of the lacrimal gland, conjunctival sac, lacrimal puncta. Lacrimal apparatus. Introduction. The structures concerned with the secretion and drainage of lacrimal tear fluid together form the lacrimal apparatus. The lacrimal apparatus consists of the following structures: lacrimal gland, ducts of the lacrimal gland, conjunctival sac, lacrimal puncta, lacrimal canaliculi, lacrimal sac, nasolacrimal duct. Lacrimal gland. It's a J-shaped serous gland. It consists of the upper large orbital part and lower small palpebral part. The two parts are continuous with each other around the lateral margin of the levator palpebrae superioris. The orbital part is almond-shaped and situated in the lacrimal fossa. The palpebral part is 1/3 of the size of the orbital part and is situated in the lateral part of the upper eyelid below the levator palpebrae superioris muscle. Ducts of the lacrimal gland. The ducts of the lacrimal gland are approximately 12 in number, about 4 or 5 from the orbital part and 6 to 8 from the palpebral part. They open into the lateral parts of the superior fornix of the conjunctival sac. Lacrimal gland secretes the lacrimal tear fluid, and its ducts convey it to the conjunctival sac. About 1 milliliter of lacrimal fluid is secreted per day. Half of it evaporates, and the remaining half is drained into the lacrimal sac. Functions of lacrimal fluid. Flushes the conjunctiva and keeps the cornea moist. Provides nourishment to the cornea. Serves to express emotions, shedding tears during grief and sorrow. Prevents infection, for it contains bactericidal lysozyme. Pathway of tears. Tears are produced in the lacrimal gland, below the lateral eyebrow. Go to lacrimal ducts. Reach the superior conjunctival fornix. Reach the anterior eyeball, and then to the lacus lacrimalis. And then go to lacrimal canaliculi, at the inner canthus. Then enters the lacrimal sac. And then to nasal lacrimal duct, which then drains the tears into the inferior nasal meatus. Arterial supply. Lacrimal branch of the ophthalmic artery. Venous drainage is by ophthalmic veins. Nerve supply of lacrimal gland. Parasympathetic secretomotor supply of the lacrimal gland. The preganglionic parasympathetic fibers arise from the lacrimatory nucleus in the pons and pass successfully through nervus intermedius, reaches geniculate ganglion, greater petrosal nerve, and to the nerve of the pterygoid canal to reach the pterygopalatine ganglion where they relay. The postganglionic fibers arise from the cells of the pterygopalatine ganglion, pass successfully through the maxillary nerve, reach the zygomatic nerve, zygomaticotemporal nerve, and lacrimal nerve to reach the lacrimal gland. Sensory innervation of lacrimal gland is via lacrimal nerve, a branch of ophthalmic nerve. That's all for the video. We'll see you next time.
To sekání je pohoda.
Nasolacrimal duct obstruction is the topic, and this is sometimes also referred to as DAC.
So hello and welcome back, guys. So hello and welcome back, guys. Question, a short note for. So though it's small. So hello and welcome back, guys. So today in this video, I'll be talking about a really small topic. I'll be talking about the nasolacrimal duct system and apparatus. So though it's small, it's really important. So hello and welcome back, guys. So today in this video, I'll be talking about a really small topic. I'll be talking about the nasolacrimal duct system and apparatus. So though it's small, it's really important. If they can ask a question, a short note for the nasolacrimal duct apparatus for ophthalmic residents and ENT residents as well. Also really important for those who are in the MBBS years. So I'll be talking about brief anatomy of the nasolacrimal duct system apparatus. So how it starts, how it originates, and how it ends up in the nasal passage. So to start with, first of all, we need to know about something about the lacrimal gland. So as you can see over here, the picture here shows the area of the lacrimal gland. This lacrimal gland has got two parts, okay? So the upper one, as you can see over here, is called as the orbital part, and the lower one is called as the palpebral part. So the upper part is like really huge, and it lies in the orbit, so it's called as the orbital part, simple. And this lies in the palpebral region, that's the eyelid region, so that's why it's called as the palpebral part. So it's actually very small, and the size of this palpebral part is actually 1/3 of the orbital part. So what does this do is that it's a serous acinous gland, so it secretes a lot of serous and acinous fluids, which can coat over the eyeball, keeps it lubricated, and then eventually all that liquid reaches a punctum here, right here, so that these puncti, when there's a negative pressure, the blinking effect of the eyeball creates a negative pressure in the nasolacrimal apparatus, and it sucks all the fluid over here inside, so that this negative pressure in the nasolacrimal apparatus punctum here, right here, so that these puncti, when there's a negative pressure, the blink blinking effect of the eyeball creates a negative pressure in the nasolacrimal apparatus, and it sucks all the fluid over here inside, so that this cycle keeps on going, and then eventually the liquid from here, that's the fluid from here, eventually ends up in the nasal passage right here at the end of it. So how it happens, I'll tell you in short, but before that I'll talk about the anatomy. So real quick, I'll start about the anatomy. So the first thing is that we have the nasolacrimal duct system over here. Before that, I'll show you the textbook diagram, which we normally read in our residency area. So as you can see over here, this is a photograph from a textbook, a standard textbook of ophthalmology. So what you can see over here, that's the lacrimal gland. A lot of ducts which come out from the lacrimal gland eventually and drain all the liquid over here over the eyeball, and then this eventually drains at the medial canthal area at the lacrimal punctum. So that's the medial canthus. If I can zoom this for you guys, you can see that's the medial canthus. That's the upper canaliculi and the lower canaliculi, which eventually forms a common canaliculi and opens up in the lacrimal sac region. The lacrimal sac eventually continues as a nasolacrimal duct. It becomes narrower and then opens up into the inferior meatus. So this is a basic rough anatomy which we always go about. So that's the labeling for you. So superior lacrimal, inferior lacrimal canaliculus, the lacrimal sac, the frontal process of maxilla, the NLD, and the inferior turbinate along with the inferior meatus. And this side you can see that's the medial canalic, that's the medial canthus, and that's the medial palpebral ligament right there. And that's the lacrimal gland along with its ducts. So this is what a rough figure we see in the textbook. So if we see another figure over here, we can see something like this. So the same figure, if I zoom in, we can see something like that. So that's the lacrimal puncti, upper and lower. Now, to start with, this is the first anatomical part. So after that, you get the canaliculi. So the canaliculi is further divided into two parts. The vertical part, which is around 2 millimeters in length, and the horizontal part, which is around 8 mm in length. So that's 2 mm and 8 mm together of 10 mm for a canaliculi. So a vertical part and a horizontal part. So in 90% of population, okay, listen carefully, in 90% of population, 90, we see that the upper and the lower canaliculi form a common canaliculi, and that opens up in the lateral wall of the lacrimal sac. But in case of 10% population, this does not happen. So individually, the upper and the lower one will open up separately in the nasal, in the lateral wall of the lacrimal sac. So that is how it is. So once it opens up in the lacrimal sac, this is the lacrimal sac, as you can see over here. That's the fundus, or the head of the lacrimal sac, which is kind of at a level higher to the inferior tarsal ligament. Okay, so there's an inferior tarsal ligament somewhere. So at this level, somewhere around, that's the inner tarsal ligament, not the inferior, but the inner tarsal ligament. And this head, or you can say the fundus of the lacrimal sac, extends vertically beyond that inner tarsal ligament. So this is some point. These are some points that you normally don't read about the anatomy. So I'll clarify about those points right here. So that's about the fundus of the lacrimal sac. The length of the lacrimal sac is roughly around 12 to 15 mm. As you can see, it's 10 mm over here, but in the textbooks, they sometimes give it is around 12 to 15 mm in length, and it is about 8 mm in width. So that's about the anatomy of the lacrimal sac, and then it continues as the nasolacrimal duct. So the nasolacrimal duct is normally around 12 mm in length. So you have to remember. Now, the most important point over here is that the question may come in Viva as what is the direction of the nasolacrimal duct? So there are two things here, okay? So this is a nasolacrimal duct region right here, and that's the region of the lacrimal sac. So the first question is the direction of the nasolacrimal duct. Now, the nasolacrimal duct, as you can see over here, this is a right side. I'll show you this direction on the 3D model as well, but I'll just clarify this on this image as well. So as you can see, this is a nasolacrimal duct, which is coming from the medial to the lateral aspect, and then again turning over inferiorly, medially. So the answer to that question should be around that it passes downwards. So it's passing downwards, right? It's passing downwards, it passes backwards, and it passes initially laterally, and towards the end of the nasolacrimal duct, when it opens up into the inferior meatus, it turns medially. So the answer should be downwards, backwards, and initially laterally, and then medially. Okay, so moving on to the 3D anatomy model right here. So as we saw, that's the if I can zoom this even further. So as we saw some time back, this was the nasal lacrimal puncti. This was the vertical, this was the horizontal part. That's the common canaliculi. If I can show you this, that's the lacrimal sac. That's the fundus of the lacrimal sac. And so as you keep on going below, you can start seeing the lacrimal sac area. Then further it continues to narrow down, and eventually it turns medially and opens up in the inferior meatus. So you should know about the pathway and the anatomy of the nasolacrimal duct. So this is sometimes a really important question for your Viva exams. So one more important thing about the nasolacrimal duct is that the nasolacrimal duct has got a lot of different valves. Now, I'll show you a photograph for that valves. So as you can see on the screen right now, there are numerous various different valves that guide the flow of the liquid from the lateral to medial direction. So as you can see over here, this is the right side eye. That's the upper canaliculus, and the lower one. So at the very beginning, at the level of the upper and the lower puncti, you can see a valve called as the valve of VRATAMA-VŠDA. So that is a valve which controls the entry of.
Pokud jste senior, vřele vám doporučuji si to přečíst. Pokud máte nemovitost, máte bank
of the tears, as you can see over here from the globe, into the lacrimal apparatus system. And as you can see over here at this area, when you reach the transition between the vertical and the horizontal part of the canaliculus, you can see a valve of Folds. This valve controls the movement from the vertical to the horizontal transition of the canalicula. So the most important valve which we all know about is the valve of the Rosenmuller. The valve of Rosenmuller is actually the valve at a superior level at the region where the common canaliculus opens up into the lacrimal sac. So there are two very important valves we should remember about, is the valve of Rosenmuller, which I just showed you, and the valve of Hasner, which is at the most inferior aspect right here. So the valve of Rosenmuller is above at the superior level, the point which where the common canaliculi opens up into the lacrimal sac. Next, we're going to find at the medial valve is the valve of medial palpebral ligament. So this is the area where there's a valve of the medial palpebral ligament. At the inferior aspect of the opening of the common canalicular ligament, common canaliculus into the lacrimal sac is the valve of Hashke. So you're going to remember the valve of Rosenmuller is above and the valve of Hashke is below. So the next one we move is the valve of Beirut or the valve of Krauss. So these valves are a lot to remember. So these come, sometimes the Viva question may go on these valves. And if the examiner wants to, he may ask a question about these valves if possible. So at least if you want, I understand that it's not important for theory exams, but for Viva it is really important. And which is really important is the valve of Hasner. So there's one more Viva question which I actually names for this valve. So valve of Hasner, Cuvier and Bianchi. Okay, so that is a Viva question for you guys. So I hope you remember all these names for your Viva questions, and be around valve of Rosenmuller, which is here, the valve of Hasner. Okay, so I hope you understood the basic anatomy of the nasolacrimal apparatus. So basically the nasolacrimal sac, the lacrimal sac is completely fibroelastic and is covered with fibroelastic tissue, the lacrimal fascia. So the lacrimal fascia mainly covers the area of the roof and the lateral wall. So this same lacrimal fascia medially separates the lacrimal sac from the median palpebral ligament anteriorly, and as we go posteriorly, the same lacrimal fascia will separate the lacrimal sac from the orbicularis oculi muscle. Okay, also the lacrimal sac over here, as you can see, is 0.5 centimeters posterior to the anterior end of the inferior turbinate at the floor or the roof, at the roof of the nasolacrimal duct system, and the afferent nerve supply is coming from the trigeminal nerve, and the efferent supply is from the facial nerve. The facial nerve is formed actually in my last video as well. I've told you about the union of the deep petrosal and the greater superficial petrosal nerve. So the blink reflects the afferent nerve supply is coming from the trigeminal nerve, and the efferent supply is from the facial nerve. The facial nerve gives off the branch called as the greater superficial petrosal nerve, the GSPN, at the geniculate, geniculate. Okay, so that is how it is formed. That's the efferent and the afferent and efferent of the nasolacrimal duct system. So I hope I've cleared the anatomy in basic. If at all you have any doubt regarding the anatomy,
And then to turn my about what the lacrimal apparatus actually is. The lacrimal apparatus is a group of structures responsible for generating tears and collecting and draining the tear fluid. The tear fluid is made up of water and contains many electrolytes, proteins, and more. It functions as a lubricant for the eye and protects it from infection. Now let's get into the anatomy. Here's a quick overview of what we'll be looking at today. And we're going to start with the relevant bones around the lacrimal apparatus to really orientate ourselves with where the components will lay. Then we'll get to the lacrimal apparatus itself. Why, when I already have a river of tears streaming out, more, and moments like this, where we're crying. We all have moments like this, where we're crying, and crying a bit more, and a bit more, and then before we know it, we're a complete mess, with our nose running like a faucet. What's going on here? Why, when I already have a river of tears streaming out of my eyes, do I need to turn my nose into a waterfall? The answer lies in the lacrimal apparatus, and lucky for you, that's what we're going to talk about in this video. Before we jump into the anatomy of it all, let's talk about what the lacrimal apparatus actually is. The lacrimal apparatus is a group of structures responsible for generating tears and collecting and draining the tear fluid. The tear fluid is made up of water and contains many electrolytes, proteins, and more. It functions as a lubricant for the eye and protects it from infection. Now let's get into the anatomy. Here's a quick overview of what we'll be looking at today. And we're going to start with the relevant bones around the lacrimal apparatus to really orientate ourselves with where the components will lay. Then we'll get to the lacrimal apparatus itself, starting from where the tear fluid is produced and ending with its drainage point. Let's get to it. First up are the bones that are involved with our lacrimal apparatus. This is the image that we're going to be looking at most often in this tutorial, where we can see the superolateral section of the right eye and the right nose cut in section. We're looking at the lacrimal apparatus on this person's right side. Many superficial structures have been removed, so we can see the deeper components of the lacrimal apparatus. I'll point these out as we go along. Looking in the superolateral aspect, we can now see a bone highlighted in green. This is part of the frontal bone. The frontal bone has been resected slightly to see the underlying structures. Let's peel off the skin and muscles for a moment and have a look at the bones underneath. The image now on the right shows more of the frontal bone, which is orange in colour. The section highlighted in green is the zygomatic process of the frontal bone and corresponds to the resected section on the image on the left. It's tucked behind here that we'll find the lacrimal gland, which we'll identify shortly. Moving to the nasal cavity, we can see right into it. The skin and cartilage have been removed, as has the nasal bone. What we can see highlighted in green now, and in our pop-out, is the middle nasal concha. This is a projection of the ethmoid bone into the nasal cavity. This image on the right is of an isolated ethmoid bone. Quite the funky bone, hey? The middle nasal conchae are highlighted in green, one on either side. The bony projection in the middle is the perpendicular plate of the ethmoid bone, which makes up part of the nasal septum. Therefore, it is in the midline of the skull. The middle nasal conchae are on either side of the nasal cavity, projecting inwards from the lateral walls.
This video is not over yet. Continue watching now the full video at kenhub.com. We have lots more videos like this one available to our premium members on our website, not to mention all the fun quizzes, related articles, and
Whenever I read about the lacrimal apparatus, it always had. And here you can see the orbital septum in blue, which tells you that the lacrimal from the lacrimal glands which are locked up, right? So, about watering. So moving on, the next structure that we're going to talk about is the canaliculus. Of the canaliculus, we can say it is situated at risk or they are increased susceptible to DAC. This happens because of the presence. Then the septum, which are called the preseptal orbicularis. Now sac into two parts. We have an upper part which is called the fundus, which is about 3 to 5 millimeters. The orbit is actually formed by the maxillary bone. And to be more specific, gland flow to the conjunctiva to remember part of the orbit. So this is the ethmoidal air sinus, right? So definitely if you were actually to make a surgical incision of your lacrimal, it lies in the basically in the mucous membrane of the lateral wall of the nose. So that part of the NLD is called
Evaluation of the lacrimal system involves dilating the puncta first. The lower puncta is dilated with the punctal dilator. The dilator is placed vertical followed by horizontal. The same is then done for the upper punctum, again passing the dilator vertical followed by horizontal. The patency of the canaliculus is involved using a Bowman probe. Usually I will use a 0 Bowman probe. The probe is placed vertical followed by horizontal. The probe is placed along the length of the canaliculus to palpate for any evidence of obstruction or soft stop. The same is then done for the upper canaliculus. A lacrimal cannula on a 3 cc syringe filled with saline is then used to evaluate the patency of the nasolacrimal duct. The lacrimal cannula is introduced into the canaliculus followed by irrigation with the saline. The patient should be able to taste the saline in the back of their throat if the nasolacrimal duct is not obstructed. The same can be done on the upper eyelid.
Jak se naučit anglicky 4krát rychleji než běžný člověk a ještě u toho mít lepší výsledky?
This video demonstrates one of the commonest OPD procedure performed for evaluating lacrimal drainage pathways. Tears drain from eyes into the nasal cavity via lacrimal system passing through lacrimal punctum, canaliculi, sac, and nasolacrimal duct. Lacrimal syringing is an examination technique for evaluating the patency of lacrimal drainage pathway. This video demonstrates one of the commonest OPD procedure performed for evaluating lacrimal drainage pathways. Tears drain from eyes into the nasal cavity via lacrimal system passing through lacrimal punctum, canaliculi, sac, and nasolacrimal duct. Lacrimal syringing is an examination technique for evaluating the patency of lacrimal drainage pathway. For the procedure, we need 1 or 2 ml syringe with 25 gauge lacrimal cannula. A curved cannula has more chances of injuring the canalicular mucosa instead of a straight one. Patient is positioned in semi-reclining state and topical anesthetic drops are instilled. Lower eyelid is gently pulled downwards and outwards for everting the lacrimal punctum and straightening the horizontal canaliculus. Lacrimal cannula mounted on the saline-filled syringe is first introduced vertically and then turned horizontally parallel to the lid margin. In cases with small punctum, a punctum dilator is used prior to syringing. Advance the cannula slowly until a stop is reached. One should feel for the stop if it's soft or hard. Irrigate the lacrimal system with 0.5 to 1 ml of saline and ask the patient if any fluid has been felt in the throat. Try to inject slowly and small amounts, since forceful injection can give a false regurgitation through the opposite punctum. Lacrimal syringing is a subjective test, hence its interpretation should be performed carefully. One should document the type of stop and the irrigation findings. Nasolacrimal duct obstruction. We get a hard stop with regurgitation of saline from the opposite punctum.
Are you sick of flipping pages to learn anatomy? Are you bored of uninspiring atlas?
A water here makes the medial lymph. So because all that fluid into pulled up that tube lake to get removed from the surface of the eye and get collected water, then the surface tension of the water and the adhesion of the water to the surfaces of that tube means that it'll get pulled up that tube kind of against gravity and kind of against what you might expect to occur. So these skinny tubes probably exist rather than there being a large opening to help draw the lacrimal fluid from the lake into the lacrimal canaliculi pass to the lacrimal sac, which would sit in here, which collects that lacrimal fluid and then drains the lacrimal fluid through the lacrimal duct or the nasolacrimal duct. And now if we were looking at a real skull, we'd see that pipe cleaner popping out inferior to the inferior nasal concha, so within the inferior meatus. Which means that, of course, we end up getting the tears in our nose. You know about that. If you cry a lot, you get the tears coming out of your nostrils. But normally, the tears are slowly creeping across your eye, draining into the nasal cavity, and you swallow them. Recycling, see? So because those lacrimal canaliculi are two tiny little tubes, that means that the lacrimal fluid in the lacrimal lake can be collected by capillary action, which will work against gravity and other forces to draw that fluid into the lacrimal sac. You know capillary action or the capillary effect? So if you stick like a skinny tube, like a skinny straw into a body of water, then the surface tension of the water and the adhesion of the water to the surfaces of that tube, collected by capillary action, which will work against gravity and other forces to draw that fluid into the lacrimal. So because those lacrimal canaliculi are two tiny little tubes, that means that the lacrimal fluid in the lacrimal lake can be collected by capillary action, which will work against gravity and other forces to draw that fluid into the lacrimal sac. You know capillary action, or the capillary effect? So if you stick like a skinny tube, like a skinny straw, into a body of water, then the surface tension of the water and the adhesion of the water to the surfaces of that tube means that it'll get pulled up that tube kind of against gravity and kind of against what you might expect to occur. So these skinny tubes probably exist, rather than there being a large opening, to help draw the lacrimal fluid from the lake into the lacrimal sac. It's pretty cool, right? The blinking then helps push the lacrimal fluid across the eye, and any dust that collects in the eye will then get pushed towards the lacrimal lake to get removed from the surface of the eye and get collected. And there's a little bit of debate, I think, about maybe some muscular forces around this region also helping pump the lacrimal fluid through the lacrimal drainage system, but you know, interesting stuff if you want to look it up and delve really deeply into it, but it's probably too deep for most people. Too deep for me. Okay, see you guys next week. I thought it was cool.
Dr. Sanjay Sainian, Professor Department Chair. We are going to demonstrate the accessory structures of the eye. We have dissected out the skin over the orbit and the eyelids, and you can see muscles here which are surrounding the eyeball. This is the orbicularis oculi. These are the orbital parts of the orbicularis oculi. This, and on the lid we have the palpebral part of the orbicularis oculi. On the medial side of the eye, there is a tough ligamentous structure, which is known as the medial palpebral ligament or the medial canthal ligament, which is caused by the fusion of the two tarsal planes. And similarly, on the lateral side, there's another ligament, which is called the lateral palpebral ligament or the lateral tarsal ligament. Orbital fibers of the orbicularis oculi, they take attachment on the orbital fibers are responsible for closing the eyelid tightly, and the palpebral fibers are responsible for closing the eyelids. And this is known as ectropion. Through the orbital septum, and to you the palpebral glands. Inflammation of the Zeiss glands produce what is known as, and for this to happen, the eyelid has to, at the tip there is another opening, that is the inferior lacrimal punctum. From each of these punctum, one small duct will go like this medially towards the canthus. That is known as the superior lacrimal canaliculus and the inferior lacrimal canaliculus. And both of them will then converge behind the medial palpebral ligament in a small sac called the lacrimal sac. And from there, the fluid will then drain into the inferior nasal meatus. The passage from the lacrimal sac to the inferior nasal meatus is known as the nasolacrimal duct. Sometimes the superior and or the inferior lacrimal canaliculi can get blocked by epithelial debris or otherwise, and then the patient will complain of overflow of tears. And therefore, as a small OPD procedure, we do what is known as lacrimal syringing. And for that, we identify the superior and the inferior punctum, and we cannulate it, and we inject it with saline. Once we inject it, it should ideally go through the lacrimal canaliculi into the lacrimal sac, and from there the fluid should come out into the nose. That process is called lacrimal syringing. Ligament. This is known as the medial palpebral ligament. This is formed by the fusion of the two tarsal plates. And likewise, on the lateral side also, we can see the lateral palpebral ligament much more clearly, which is attached to the lateral orbital margin. So these two ligaments provide attachment to the auricularis oculi. Now let me reflect superior fibers, and after separating the eyeball from the orbit, what are the structures we notice? We have removed most of the periorbital fascia and the retrobulbar fat, and we notice this structure here. This is the lacrimal gland. This is the orbital part of the lacrimal gland, and we can see this muscle here. This is the levator palpebrae superioris muscle.
This is Elias walking you through the examination of the complaint of, and then you have canaliculi, if blockages. Then if you press the lacrimal sac, there's going to be some regurgitation of regurgitation test, and that is when the blockage is distal to the lacrimal sac. Then if you press the lacrimal sac, there's going to be some regurgitation of fluid out of the punctum. So when we are doing the examination, the first thing that we have to do is we have to see whether the lid margin is completely approximated to the conjunctiva. And after seeing that, we're going to ask the patient to close his eyes forcefully and then open them up and see whether there's any rolling of the lid margin or not. If it's not, that means that is working perfectly fine. Then we're going to slightly pull this up to see the lacrimal punctum, and that is the area that you see here, and that's the lacrimal punctum. After doing this, you also want to see whether there is any blockage of the lacrimal sac, and for that what you need to do is you need to do this compression test. So you compress the lacrimal sac. To do that, we first need to stabilize our hand so that when we're doing this test, we are not poking in the eye of the patient. So I put my hand on Irfan's forehead, and then I'm going to ask him to look all the way up. He's looking up. I'm going to find the orbital margin and then slowly take my finger all the way to the gap that I feel here, and then I'm going to push it in and up. So this is the movement that I'm doing, and as you can see, there is no regurgitation that's happening here, which would mean that there is no distal obstruction. Thank you.
So here's a little stent right there. That's in the tear drain. And so what we're going to do is go ahead and look up for me. Good. And just keep looking up. And it's a little bit of a tickle. And that's it.
Wow.
And that's it, guys. See? So that's a little stent that was holding everything open. So here's a little stent right there. That's in the tear drain. And so what we're going to do is go ahead and look up for me. Good. And just keep looking up. And it's a little bit of a tickle. And that's it.
Wow.
And that's it, guys. See? So that's a little stent that was holding everything open. So here's a little stent right there. That's in the tear drain. And so what we're going to do is go ahead and look up for me.
Hi, let's talk about the lacrimal system. In this video, we'll discuss the components, where to go, but underneath this illustration, we can see the trigeminal nerve here, and the and a nerve called the deep ganglion there. So this is a peripheral parasympathetic ganglion known as the pterygopalatine ganglion. An older name for it is sphenopalatine, and it's found in the
secreting tears and they don't fall over, so there must be some drainage system or some collecting system which is taking everything away. So what happens is that you see these little thank God they don't come out of our nostrils. They deposit nerve cross film actually present is right, so and regular for refraction, right? So there are lacrimal canaliculi open up here into these structures. These holes are actually called the lacrimal puncti, right? Puncti. These holes are called the lacrimal puncti, right? And these holes and these pipes or these canals are called the lacrimal canaliculi, right? These lacrimal canaliculi join together, right? And then they deposit the tears into this big old sac. Hey everyone, today we will be starting our new chapter on the lacrimal system. So before we get into any diseases, first we need to understand the anatomy and physiology relevant to the lacrimal system, right? So here's here's a little diagram I tried to make on Microsoft Paint. The lacrimal system has basically two components, right? There's the component which is secreting stuff, and there's the component which is draining the secreted stuff outside, right? This gland up here, which is which does majority of the work, which produces tears, that gland is called the lacrimal gland. There are two other glands as well, the gland of Wolfring and the gland of Cross. We'll be studying this, we'll be reading this in the theory in the next slides. So the lacrimal gland here, let me label this as a L. So the lacrimal gland here, it's an exocrine gland, right? It has ducts, and there are like 10 to 12 ducts. I drew like 5 or 6 here, maybe 10 to 12 ducts. They pierce the conjunctiva, right? Let me tell you where. So here's the eyelid, here's the eye. I keep drawing this diagram again and again. And we have the we have the conjunctiva, right? Covering here. Here's the fornix. Here's the conjunctiva again. Here's another fornix, right? Fornix is this place where it curves. This is corner kind of place, right? And this gland over here, the lacrimal gland, is here, right? And its ducts, it penetrate through the cornea, through the upper fornix, right? The superior fornix, and they deposit their tears here. And when we blink, we open and close our eyelids. That causes the tears to distribute all over the eyelid, right? So lacrimal gland producing tears which come here, right? And they deposit all over the eye. And then because it keeps secreting tears and they don't fall over, so there must be some drainage system, some collecting system which is taking everything away. So what happens is that you see these little pipe kind of things, right? Canals. These are called the canaliculi, right? Canaliculi actually means small canals. So these are called the lacrimal canaliculi, right? And these lacrimal canaliculi open up here into these structures. These holes are actually called the lacrimal puncti, right? Puncti. These holes are called the lacrimal puncti, right? And these holes and these pipes or these canals are called the lacrimal canaliculi, right? These lacrimal canaliculi join together, right? And then they deposit the tears into this big old sac. This sac is called the lacrimal sac, or it's even called the nasolacrimal sac. Remember, this is the eye, right? And over here we do have the nose, right? And these tears, when they are collected by when they go inside through the puncti and through these nasolacrimal canals all the way into the nasolacrimal sac. From the nasolacrimal sac, they have a connection with the nose, right? And these tears essentially drop into the nasal cavity, but thank God they don't come out of our nostrils. They deposit quite towards the posterior side, and we just swallow them without even knowing, right? So production system, drainage system, right? Yeah. So glands, as I said, the main lacrimal gland, which we were discussing right now, lacrimal gland, if you really want, it has two parts. It has the main, there is the main lacrimal gland, it has the orbital part, right, which we were discussing. There's also a little small part called the palpebral part, right? Palpebral part means it's within the related to the eyelid, right? Palpebral part and orbital part, if you really want to know, they are the parts of the lacrimal gland. And the nerve supply of the lacrimal gland is important, especially the secretomotor part, right? So nerve supply of the main lacrimal, it's a gland, right? And a gland always, just like a muscle, it requires a command to work. And so this command is actually supplied by the facial nerve through the parasympathetic autonomic nervous system. Remember, whenever we talk of secretions, mostly it's the parasympathetic system which is active, right? So facial nerve has a sensory part and a motor part and a parasympathetic part as well, right? And the parasympathetic part of the facial nerve actually supplies the main sensory. So
věděli jste, že když pobíráte důchod, můžete získat 90 000 na pořízení fotografií?
So the tear drainage system, as we discussed, we had the lacrimal canaliculi, we had this lacrimal puncti, right, part of the conjunctiva, and deposit secretion of the meibomian gland, right? And that secretion is fatty. It's full of fatty acids. So let's give that a yellow color, right? As a result, is the layer finished. Oh no, wait, we have functions. Okay, stay for a while. Okay, let's have a black screen here. So what we will see is that we have this layer of cells, right? Okay, it's really difficult to draw on the mouse sometimes. Patience, right? Layer of cells, right? This is a part of the cornea, right? The conjunctiva. This is a part of the conjunctiva, and deposited on this conjunctiva, let's give it a proper color, is the layer of water, the aqueous layer, right? So conjunctiva, upon the conjunctiva, we have the aqueous layer, right? And this aqueous layer, as I mentioned in previous videos, it is preserved by the secretion of the meibomian gland, right? And that secretion is fatty. It's full of fatty acids. So let's give that a yellow color, right? As a result, this is lubricated. This layer cannot really evaporate so easily with the fatty layer above it, the oily layer above it. So that's it, right? So the tear film is composed of three parts: the mucus layer, right? The mucous membrane layer, which is actually the cornea, a part of the outermost part of cornea. Then we have the watery layer secreted by the lacrimal gland. Then we have the lipid layer, which is secreted by meibomian gland, right? 1, 2, 3 layers, right? Mucous membrane, aqueous layer, lipid layer, easy. And functions, okay, function of the lacrimal system, right? It makes the anterior corneal surface smooth and regular for refraction, right? So there is no like rough edges to bend the light in a different way. So it's smooth, it properly bends, it properly transmits light. It prevents the drying up of the cornea, right? And it supplies oxygen to the corneal epithelium. Remember, the cornea does not have any blood vessels. It does not have any blood supply. Another function of the lacrimal system is it prevents infection due to presence of antimicrobial system, specifically the enzyme called the lysozyme, right? So lysozyme is an enzyme, right, and it destroys the cell walls it punches holes in the cell wall of bacteria, in cell walls of bacteria. It serves as a medium for the removal of debris, and it lubricates the cornea and the eyelid interface. That's it. Nothing so difficult, right? In the next few lectures, we'll be talking about the diseases of both the secreting system and the drainage system as well. Yeah, I think that's it. Yeah, like, subscribe, and share if you think there is the main lacrimal gland, it has the orbital part, right, which we were discussing. There's also a little small part called the palpebral part, right? Palpebral part means it's within the related to the eyelid, right? Palpebral part and orbital part, if you really want to know, they are the parts of the lacrimal gland, by the facial nerve through the parasympathetic autonomic, which is active, right? So the parasympathetic part of the facial nerve, vasomotor means it acts glands of Wolfram as well, right? So the tear drainage system, as we discussed, we had the lacrimal canaliculi, we had this lacrimal puncti, right? And they would deposit into this lacrimal sac, right? So lacrimal puncti, these holes, lacrimal canaliculi, these canals, right? And nasolacrimal sac right here, right? Easy, nothing so difficult about that. We studied it. Then comes the interesting topics. Let's have a proper view of how the tear film actually looks like. So it has three layers: the mucous membrane layer, the aqueous layer, and the lipid layer. We all know that because the tear film has the meibum, right, from the meibomian glands, so it'll have a lipid layer as well, because it also gets tears from the lacrimal gland. It'll have an aqueous layer as well. And we also know that because the tear film is actually deposited on the conjunctiva, so it is in contact with the mucous membrane layer of the conjunctiva. Let me elaborate what I mean. But if you understood, you can move forward. I think that will be enough. The presentation is finished. Oh no, wait, we have functions. Okay, stay for a while. Okay, let's have a black screen here. So what we will see is that we have this layer of cells, right? Okay, it's really difficult to draw on the mouse sometimes. Patience, right? Layer of cells, right? This is a part of the cornea, right? Sorry, yes, the conjunctiva. This is a part of the conjunctiva, and deposited on this conjunctiva, let's give it a proper color, is the layer of water, the aqueous layer, right? So conjunctiva, upon the conjunctiva, we have the aqueous layer, right? And this aqueous layer, as I mentioned in previous videos, it is preserved by the secretion of the meibomian gland, right? And that secretion is fatty. It's full of fatty acids. So let's give that a yellow color, right? As a result, this is lubricated. This layer cannot really evaporate so easily with the fatty layer above it, the oily layer above it. So that's it, right? So the tear film is composed of three parts: the mucus layer, right? The mucous membrane layer, which is actually the cornea, a part of the outermost part of cornea. Then we have the watery layer secreted by the lacrimal gland. Then we have the lipid layer, which is secreted by meibomian gland, right? 1, 2, 3 layers, right? Mucous membrane, aqueous layer, lipid layer, easy. And functions, okay, function of the lacrimal system, right? It makes the anterior corneal surface smooth and regular for refraction, right? So there is no like rough edges to
Muziker má milion radostí pro každého. Kytary, klávesy a...
Alright, so we'll be looking at the lacrimal apparatus. First thing we'll be checking out is your lacrimal gland, which is this structure right here. Looks kind of like a interesting brain structure, but actually it's not. It's a lacrimal gland. Alright, so we'll be looking at the lacrimal apparatus. First thing we'll be checking out is your lacrimal gland, which is this structure right here. Looks kind of like a interesting brain structure, but actually it's not. It's a lacrimal gland. Behind here, you'll see these green things right here. These are called your lacrimal duct. The lacrimal papilla, or papillae, is actually, papilla, I think of it like a butterfly, like papillon. So then you would see it's kind of, looks like a weird butterfly right here. And actually the punctum is actually a hole that is not really visible in this model, but it would be, a punctum would be in here. And the punctum would actually, your teardrops would go into that and it will enter this structure called the lacrimal canaliculus, which is this part right here, triangle. The lacrimal canaliculus goes into what we call the lacrimal sac, which is this structure here. And the lacrimal sac would have everything secreted into the nasolacrimal duct, which is not really visible in this apparatus. The last structure we'll be looking at is your lacrimal caruncles, which is right, this pink part right here. And that's it, guys.
Totally free of cost. Also, very rarely you may have the where it is situated. It basically important system. The
This is called Jones 1 test. So the first interpretation of about the chronic dacryocystitis. So chronic dacryocystitis. So if there are the filling defects, it can be because of some internal masses like stones or internal tumors. Okay. Remember, if there are lymphoid proliferation of
Víš, podle čeho se pozná dobrá angličtina? Já jsem si celý život myslel, že je to podle toho, kolik slovíček znáš, jak...
नमस्कार। लैक्राइमल ग्लैंड्स के सुपीरियर कैनलिकुलाई फिर लैक्राइमल सैक देख सकते हैं पंक्टम की पोजीशनिंग को। तो टीयर एंटर करता है, आप देखें टीयर ग्लैंड से एंटर किया, यहाँ पर ग्लैंड से बना और डक्ट्स के द्वारा एंटर किया आईज में, और यहाँ से पंक्टम की लेंथ 18 to 25 है। आप देखें टीयर ग्लैंड से एंटर किया, यहाँ पर जो पाथ था, जो ओपनिंग थी, उसकी बात हम कर रहे थे। एनाटॉमिकल ऑब्स्ट्रक्शन होने पर भी ऐसा हो सकता है। हम यहाँ पर देख सकते हैं पंक्टम की पोजीशनिंग को। तो टीयर इन्फेक्शन हो गया है या फिजियोलॉजिकल वेरिएशंस होने। तो दो कंडीशन पढ़ चुके हैं, एक एपीफोरा जिसमें वाटरिंग होता है, क्यों होता है इसका कारण हम लोगों ने, जिसमें लैक्राइमल सैक में इन्फेक्शन हो जाता है। तो कोशिश करेंगे क्रॉनिक डैक्रोसिस्टाइटिस को, फिर स्टेज ऑफ म्यूकोसेल, इसी वजह से पहले कॉनिक हुआ ये जो इंफीरियर मिएटस पर जाकर के। इस इमेज में हम क्रिगलर मसाजिंग कैसे की जाती है उसको करते हुए देख सकते हैं। क्रिगलर मसाजिंग से कई बार ऐसा होता है कि जो सैक है वो खुल जाता है। इस मींस सैक का ट्रीटमेंट देंगे, कैसे करेंगे वो सारी चीजें डिस्कस में आ चुकी हैं। फिर कॉन्जेनाइटल डैक्रोसिस्टाइटिस, ये क्या होता है? कॉन्जेनाइटल बचपन से ही है डैक्रोसिस्टाइटिस। तो लेस देन 12 मंथ्स का बेबी है तो कोई सर्जरी नहीं बल्कि ट्राई करेंगे क्रिगलर मसाजिंग।
The primary components of tears: mucin, The primary components of tears: mucin, aqueous, and lipid combine to create a complex viscoelastic structure. This complex structure is responsible for a multitude of important functions. The primary components of tears: mucin, aqueous, and lipid combine to create a complex viscoelastic structure. This complex structure is responsible for a multitude of important functions. Lipids prevent evaporation, lubricate, and stabilize the tears. Meibomian glands at the margins of the upper and lower lids produce and inject complex oil into the tears with each blink. This thin layer of oil prevents tears from evaporating and increases lubrication and comfort. Additionally, the phospholipids found in this oil stabilize the tear layer and improve cohesiveness. In a healthy eye, tear production is carefully balanced and controlled. Excessive evaporation of tears can stimulate overproduction of the aqueous component. This chronic overproduction of aqueous may be linked to eventual inflammation of the lacrimal gland. The symptoms of dry eye can include feelings of dryness, grittiness, burning, ocular tiredness, and discomfort. The oil produced by the meibomian glands becomes increasingly cloudy and thickens further to a paste-like consistency. On manual expression, these properties, as well as plugging of gland orifices, may be evident. As the condition worsens, eyelids display signs of inflammation and dilated blood vessels. With dry eye, sensitivity to environmental factors like wind, temperature, and humidity increases. Interference with normal vision may become noticeable. Often, the individual considers it part of the normal aging process, when in fact, dry eye can have a significant impact, causing loss of productivity and poorer quality of life. One of the most common treatments for meibomian gland dysfunction and associated dry eye is at-home warm compress therapy. This approach has limited clinical effectiveness. Heat is wicked away by blood vessels in the eyelids, limiting the amount of heat reaching the meibomian glands. Beyond the lack of effectiveness and the onerous routine for the patient, use of warm compresses can introduce excessive pressure on the globe. The LipiFlow system uses heat and pressure to clear blocked meibomian glands. By applying heat directly to the glands on the inner eyelid surface, heat rapidly and efficiently raises gland contents, liquefying any blockage, making it easier to remove from the gland. Gentle pressure is applied from outside the lid from the base of the gland to the gland opening, removing blockage and flushing dead cells from the gland. During this process, stagnant gland tissue may be removed from the glands. Maintaining normal meibomian gland health and function is critical to the long-term maintenance of ocular surface health and good vision.
Ušetřete až 50% a užijte si doručení zdarma. Nakupujte ještě dnes na beliany.cz.
When the eye persistently normal present in the upper and lower. To persistently tears, a blocked tear duct may be present. It is a very common condition, especially in newborns and when the eye persistently tears, a blocked tear duct may be present. It is a very common condition, especially in newborns and young children. Many infants are even born with a blocked tear duct. Normally, the tears produced by the lacrimal gland to keep the eye moist drain into the tear duct openings that is present in the upper and lower eyelids. The tears then pass into the lacrimal sac before draining out into the nose via the nasolacrimal duct. If a blockage is present, the tears back up into the eye. To surgically correct this condition, a Crawford stent can be placed. A dilator is first used to enlarge the openings into the tear ducts. Next, a Bowman probe is used to dilate the tear duct canals. A syringe containing a bright yellow-green dye called fluorescein is then injected into one of the tear ducts. If there is no blockage present, the fluorescein dye drains into the nose. However, if the dye appears over the eye, a blockage is present. A Crawford stent is then placed by first threading one probe through the tear duct, which is then passed through the nasolacrimal duct and out the nose. The other Crawford probe is passed through the other tear duct in a similar manner. The stent that is connected to both Crawford probes is then cinched down close to the tear ducts. The stents are then tied together, which then retracts up into the nose. The stent is usually removed after several months by cutting the stent and pulling it out.
Are you sick of flipping pages to learn anatomy? Are you bored of uninspiring atlases and
This is the eye model right here, and some of the structures that we can see from this vantage point would be this structure right here. This is the lacrimal gland, and we can see lacrimal gland under here as well. These This is the eye model right here, and some of the structures that we can see from this vantage point would be this structure right here. This is the lacrimal gland, and we can see lacrimal gland under here as well. These green things right here are lacrimal gland ducts. What's going to happen is the tears produced by the lacrimal gland will pass through these lacrimal gland ducts and flow across the eye from lateral to medial. Okay, this would be the medial aspect over here where the medial canthus is. Okay, we can see the lacrimal sac over here. They would collect the tears and bring the tears down into the nasolacrimal duct, which would bring the tears into the nasal cavity. This is why we get a runny nose when we cry. Okay. Some of the other structures we can see here, this structure right up here, you can see it looks kind of muscular. That structure is going to be the muscle known as the levator palpebrae superioris. Levator palpebrae superioris is going to be the muscle in the upper eyelid, and when this muscle contracts, it will raise the upper eyelid so that we can open our eyes. Okay? Now, if I were to take this off, we would be able to see the eyeball a little bit better, and here it is. Okay? Some of the structures we can see on the eyeball, this shiny structure right here, if I were to turn the eye to the side, we would be able to see that a little bit better. Look at that window right there. This is the cornea. This cornea right here is going to be the main focuser of light rays as they enter the eye. Okay, this is going to be the greatest bender of light rays. The lens that we'll see on the inside of the eye, the lens is more of a fine focus. But this will focus the light the most, the cornea. If someone were to wear contact lenses, those contact lenses would sit right on top of the cornea, almost as if you have a new cornea. Okay? When people get laser surgery for their eyes, that laser is going to reshape the cornea so that it focuses light better onto the retina. Okay? But that's the cornea. And the cornea is continuous with this white layer right here. This is the sclera. This would be superior rectus. Inferior rectus we would be able to see here. Lateral rectus we would see on the side over here. And then medial rectus would be on the side here. The nose would be right here. One of the muscles we could see is this muscle right here, which would be the lateral rectus muscle. Okay, remember the other side of the eye was the medial side where the tears drained into the nasal cavity. This is the lateral side, lateral rectus. This muscle up here is going to be superior rectus. And then there's going to be an inferior rectus muscle underneath here. And then over top of inferior rectus, there's going to be this inferior oblique muscle right there. Okay, superior oblique we would be able to see on the top if I were to turn the model like so and show you the tendon right here of superior oblique. We can also see inferior rectus right here, and then this structure right here, this is going to be the optic nerve where it exits the back of the eye. Underneath the inferior rectus, we see this yellow stuff. This is fat. There's going to be fat padding inside the orbit to protect the eye. Now here's the cornea, and if I were to take the top of this model apart, we can see more stuff on the inside. We get a better view of the iris right here. Okay, this is the iris. This is what's going to give you your eye color. This person has blue eyes because they have a blue iris. There's a little hole in the center of the iris known as the pupil. That pupil is going to allow light rays to pass into the eye so those light rays can hit the photoreceptors in the retina that's in the eye. Okay? This pupil can change sizes. It can get smaller or larger because of the muscles in the iris here. And that pupil will change sizes based on various conditions. If you want to allow less light into the eye, the pupil will constrict. If you want to allow more light into the eye, the pupil will get wider or dilate. From this vantage point, we can also see the choroid layer. The choroid layer is this dark vascular layer. There's a lot of blood vessels in this layer. If we were to open this part of the model, in the anterior cavity we have aqueous humor in here, but back here in the posterior cavity we're going to have vitreous humor. This structure right here represents the vitreous humor or vitreous body. This vitreous body has a couple of functions. One of the things it will do is help to hold the retina onto the back of the eye. The only place the retina is attached is where the nerve fibers exit the back of the eye to make the optic nerve. Another thing that this will do is absorb the heat generated by the light rays so the retina is not damaged. We can also see from this vantage point the lens right here. This will do is absorb the heat generated by the light rays so the retina is not damaged. We can also see from this vantage point the lens right here. Okay, if I were to pick up the lens and show you what it looks like, we would see it here. Okay. Now the lens is going to be the fine focus in the eye. This lens is going to be able to change shape. It's flexible. This lens is suspended from the ciliary body, which we can see in here as being this red portion here. Okay. Those are ciliary muscles that will constrict and dilate to change the shape of the lens. Okay. These white things right here are suspensory ligaments. They'll suspend the lens from the ciliary body. When the ciliary body muscles contract, they'll constrict this circular opening right here, which will put slack on the suspensory ligaments, which will allow the lens to get fatter. But when the ciliary muscles relax, they'll dilate this opening, make it wider, pull or tighten the suspensory ligaments so that the lens will get thinner. And this orange layer is the retina. This would be part of the optic disc where the optic nerve would exit the back of the eye. We can see this little pink structure right here. This is the macula right here, and the macula is a part of the retina that has a high concentration of cones, which are color receptors. In the center of the macula, we would have the fovea centralis, and the fovea centralis is made exclusively of cones. That's where light gets focused. Okay. Out here in the periphery, in this part of the retina out here, we've mainly got rods. Rods are going to be receptors that will detect low levels of light. If you found this video helpful, click like and consider subscribing to my channel. Don't forget to visit www.humanbody
Remember me, I'm the one who had you, baby.
The lacrimal apparatus. Anatomy of the tears. Hi! Let's begin with some fun facts about tears. Animals and humans both produce tears, but in humans, it is most often an emotional response. Humans produce 3 types of tears: basal tears, emotional tears, and reflexive tears. Basal tears help to keep the eye lubricated at all times. Their triple-layered structure provides nourishment and helps protect the eye against dust and foreign particles. Emotional tears are shed as a response to heightened feelings of sadness or happiness. Reflexive tears are most often a response to chemical irritants, such as when slicing an onion or when exposed to allergens. Tears are salty and contain antibodies, enzymes, and hormones. This makes them chemically very similar to saliva. All the components involved in the production and drainage of tears are collectively called the lacrimal apparatus. It's like a water park, with the lacrimal glands stationed at the highest point, continuously producing tears. The ducts and canaliculi are like water slides, helping to transport the tears towards the lacrimal sac. And finally, the biggest slide of the park, the nasolacrimal duct, ends in a pool at the bottom. Let's now get into the anatomical details of each of these structures. The lacrimal glands are the primary producers of tears in the lacrimal apparatus. They are located above the outer corners of each eye, within the upper eyelids. The gland has 2 lobes, the upper large orbital and lower small palpebral lobes. Both lobes of the lacrimal gland are made up of serous cells, which is why tears are more water in nature. The lacrimal glands are supplied by the lacrimal nerve, a branch of the ophthalmic nerve. Tears produced within the lacrimal gland are drained by the lacrimal ducts and transmitted to the eye. Blinking helps move these tears towards the medial corner of the eye, where the lacrimal canaliculi are located. They begin as small openings called puncta, visible as tiny dots near the medial side of the eye. Each eye has 2 puncta, one each on the upper and lower eyelid. Blinking causes tears to pool towards the inner corners where the puncta are situated. The function of the lacrimal canaliculi is to collect these tears from the surface of the eye and transmit them to the lacrimal sac through the common lacrimal canaliculus. The lacrimal sac is the dilated upper end of the nasolacrimal duct situated within the bony lacrimal fossa of the medial wall of the orbit. It acts as a reservoir for tears before they continue their journey into the nasal cavity through the nasolacrimal duct, which runs within the bony structure of the maxilla. Ultimately, the nasolacrimal duct opens into the inferior meatus of the nasal cavity. Tears produced by the lacrimal apparatus primarily drain through the lacrimal canaliculi and into the nasal cavity. However, during episodes of intense weeping or exposure to certain stimuli, tear production exceeds the drainage capacity, resulting in overflow onto the cheeks and subsequently a runny nose. Now let's move on to the clinical significance of the lacrimal apparatus. Epiphora is a medical term for excessive tearing of the eyes that goes beyond normal tear production for lubrication or emotional response. Tears overflow onto the face, typically running down the cheeks. The most common cause is a blockage of the tear drainage system. Another commonly seen condition is dry eye syndrome, also known as keratoconjunctivitis sicca, caused either due to decreased production of tears or rapid evaporation of tears. Let's end with a fun fact. We've all heard newborn babies cry around the clock. But did you know most newborns cry without tears? This is because lacrimal ducts completely develop only by the second month. With that, we come to the end of the session on the lacrimal apparatus. We hope you had fun learning with us.
Učení se angličtiny v dnešním světě není jenom o slovíčkách a gramatice. Je to taky o tom se naučit anglicky myslet. Toto je
And his Lord, this is how our lacrimal
Hello. I like
articulations of this small portion of the nasal cannot train normally. So this lecture is
If you've noticed that your baby's eye is constantly watering, then they may have something called a blocked tear duct, and in this video I'm going to teach you how to safely and correctly perform a tear duct massage for your baby at home to how to safely If you've noticed that your baby's eye is constantly watering, then they may have something called a blocked tear. If you've noticed that your baby's eye is constantly watering, then they may have something called a blocked tear duct, and in this video I'm going to teach you how to safely and correctly perform a tear duct massage for your baby at home to try and help solve this. Now, blocked tear duct happens in around 5% of newborns, so it's a really common problem, but thankfully it doesn't damage the eyes or the vision, and it's actually harmless. In most babies, the condition clears by itself before they're 1 or 2 years old, and in this video we're going to cover symptoms of a blocked tear duct, a demonstration of how to correctly perform a tear duct massage, a brief overview of what surgery for a blocked tear duct involves, and finally an important condition that you should be aware of. As ever, each section If you've noticed that your baby's eye is constantly watering, then they may have something called a blocked tear duct. And if you've noticed that your baby's eye is constantly watering, then they may have something called a blocked tear duct. And in this video, I'm going to teach you how to safely and correctly perform a tear duct massage for your baby at home to try and help solve this. Now, blocked tear duct happens in around 5% of newborns, so it's a really common problem, but thankfully it doesn't damage the eyes or the vision, and it's actually harmless. In most babies, the condition clears by itself before they're 1 or 2 years old, and in this video we're going to cover symptoms of a blocked tear duct, a demonstration of how to correctly perform a tear duct massage, a brief overview of what surgery for a blocked tear duct involves, and finally an important condition that you should be aware of. As ever, each section of the video is timestamped and it's split into chapters. So just so we know the area that we're talking about, the tear duct is a little tube that helps to drain tears from the eyes, and it just sits next to the nose here, and you can see a diagram on screen now. Now this is important because it's where you're going to be performing the massage, and in quite a few babies and infants this tear duct can get blocked, and usually it's just because a bit of membrane, which is another word for tissue, hasn't fully opened up. Now if this happens, tears can overflow onto your baby's face, and it may look like their eye is watering all the time, or that the eye is infected. They may have some clear or yellowish goop or crusts on their eyelids or eyelashes. Now, because other things can cause these signs and symptoms, like infections, it's always worth getting your baby checked out by your doctor to make sure everything's okay. But if it is a blocked tear duct that's causing these symptoms, then a tear duct massage, also known as a Kreigler massage, can help open up the blocked duct so that tears can flow through it. And now we're going to cover a practical demonstration of just how you can safely and correctly do this at home. So if your baby's got stickiness and discharge around the eye, you can gently clean this away using clean water and cotton wool. Because you're going to be putting your finger close to your child's eyes, first of all make sure that you thoroughly wash your hands with soap and warm water before and after the massage. Next, you want to place the tip of your index finger against the side of your child's nose in the corner of the eye with the blocked tear duct. Make sure that you support your child's head when you're doing this. You want to press firmly and move your index finger in short downward strokes 3 to 5 times as we're demonstrating here. Now having a blocked tear duct on both sides is uncommon, but if this is the case, just repeat this step on the other side. And you should repeat these steps 3 times each day in the morning, noon and night until it settles down. Your child may also need eye drops, and if this is the case, the doctor or your health provider will give you instructions on what, how and when to use them. So what happens if a blocked tear duct persists despite this technique? Well, the good news is actually that 90% of children who've got a blocked tear duct will find that it resolves with this simple technique without the need for any further intervention. But if the symptoms don't get better by the time they're 12 to 18 months of age, then an eye specialist called an ophthalmologist may consider performing a procedure called syringe and probing. Now this will be done under general anaesthetic, meaning that your child will be asleep. And the procedure uses a very thin instrument which is passed into the tear duct to open it up. And the good news is that it's usually successful. Finally, what should you look out for? Well, in very rare cases, a tender red lump or swelling can appear in the inner corner of the eyelids. This can indicate a serious infection of the tear sac known as dacrocystitis, and you would most certainly need to see your doctor about this if this develops. And I've put a picture of this on screen for you to know what it looks like. So if your child has experienced a blocked tear duct and you found this video helpful, or if you just want to share your own experiences to help others, please do leave a comment in the comments section. This is really valuable and I would welcome this. As ever, I've included all of the resources used to make this video in the description box. These contain lots more useful information, so please do check those out if you want to learn more about the topic. And if you did enjoy the video and you learned something new, please consider liking it and subscribing to the channel for weekly medical education videos. Until next time, thanks for watching and bye. So please do check those out if you want to learn more about the topic. So if your child has experienced a blocked tear duct and you found this video helpful, or if you just want to share your own experience with your doctor about this if this is successful. Finally, what should you look out for? Well, in very rare cases, a tender red lump or swelling can appear in the inner corner of the eyelids. This can indicate a serious infection of the tear sac known as dacrocystitis, and you would most certainly red lump or swelling can appear in the that it's usually successful. Finally, what should you look out for? Well, in very rare cases, a tender red lump or swelling can appear in the inner corner of the eyelids. This can indicate a serious infection. An ophthalmologist may consider will find that it resolves with this simple technique without the need for any further intervention. But if the symptoms don't get better by the time they're 12 to 18 months of age, then an eye specialist called an ophthalmologist may consider performing a procedure called syringe and probing. Now this will be done under general anaesthetic, meaning that your child will be asleep. And the procedure uses a very thin instrument which is passed into the tear duct to open it up. And the good news is that it's usually successful.